My name is Teresa Scott, and today I'm going to be doing my assessment on musculoskeletal, abdominal, and neuro. Today I have with me Stephen Scott. He's going to be assisting me in this video. So the first thing to do is whenever we're doing an assessment of the abdominal, musculoskeletal, and neuro, first thing I want to do is come in. I want to introduce myself to the patient, let them know who I am. My name is Teresa. I'm going to be your nurse today. Can you please state your name for me?
Stephen Scott.
Can you tell me where you're at?
I'm in Bryan, Arkansas.
Okay. Can you tell me why you're coming in today?
Checkup.
Okay. Do you know what today's year is? What year it is?
2016.
What today's date is?
April the 5th.
Okay. What day of the week it is?
It is Thursday.
Okay. So our patient is alert and oriented. Times for person, place, time, and situation. He's aware that we're going to be doing our assessment today. And after I establish the patient's orientation, I want to gather my supplies and I want to wash my hands. The next thing to do in the assessment, we're first going to start off with the neurological component. He's already A&O times 4. And then next thing I'm going to do is I'm going to go through the cranial nerves with him. Mr. Scott, I'm just going to do a series of cranial nerves. It's 1 through 12. I'm going to guide you through each one. First cranial nerve I'm going to test is cranial nerve 1. Cranial nerve 1 is olfactory. It's a smell test. At this point, in order to determine if you can smell or not, I need you to occlude one of your nostrils. Can you sniff for me? Occlude the other one. Sniff. Okay. So we know that both of his nostrils are patent. At this point, I'm going to ask Mr. Scott to close his eyes. And what I'm going to do is I'm going to weigh something underneath your nose, and I just need you to identify the smell for me, okay?
Mm-hmm.
Can you identify the smell for me of that?
Some type of spray or fragrance or something like that.
Okay, let's smell it in.
It's a paper.
Hard time identifying what it is.
Yeah.
Okay, you can open your eyes. As you can see, it's just the alcohol pad. At this point, we will assess further to determine what's going on with the smell as far as identifying that object. After we do the smell test, we'll next move on to assessing our cranial nerves 2, which is optic. At this point, in order to test cranial nerve 2, I'm just going to give Mr. Scott an object or a word to a piece of paper to identify a word on. Let's see. Okay. I'm going to hold this piece of paper a couple feet away from you. I just need you to identify the top line.
Lymph nodes of the head and neck.
Okay, so Mr. Scott correctly identified what the phrase stated, which is lymph nodes of the head and neck. Next, I'm going to test his perla. What I'm going to do, Mr. Scott, is I'm just going to flash some light in your eyes. And at this point, we want to dim the lights, make sure that we can see the pupils constrict. But I'm just going to go ahead and flash them. Okay. So pupils are equal, round, and reactive to light. And at this point, we'll test accommodation. I'm going to have Mr. Scott look at my pen light. And what I'm going to do is, whenever I bring my pen light closer, just with your eyes only, your eyes will merge. Okay? Okay. So pupils are equal, round, reactive to light with accommodation noted. Next thing I'm going to do is I'm going to test cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducent. When testing these nerves, I'm going to do 6 cardinal gazes. So, Mr. Scott, with your eyes only, I just need for you to follow my pen light, okay? Okay, so cranial nerves 3, 4, and 6 are intact. Next, I'm going to move on to cranial nerve 5, which is trigeminal. What I'm going to have Mr. Scott do at this point, I'm going to ask for him to smile for me, frown, okay, clench your teeth, okay. So now that our cranial nerve 5 is intact, while doing 5, I'm going to move along to cranial nerve 7, which is our facial nerve. So, Mr. Scott, what I'm going to do is I'm going to touch your face with an object. I need you to tell me if it's soft or dull and where I'm touching your face at with it, okay? So close your eyes for me.
Dull.
Where am I touching you? Okay.
Soft.
Where?
Left cheek. Dull. On the chin. Hard. Cheekbone.
Oh, okay.
Dull.
Okay. So cranial nerve 7, facial's intact. At this point, we'll do cranial nerve 8, which is a whisper test. I will stand directly behind the patient and I'll whisper a word in each ear, and the patient will correctly identify the word for me as what I'm whispering. And just to go through that, I'm going to whisper
Blue.
okay,
White.
okay. Patient correctly identified both words. Cranial nerve 8, which is auditory, is intact. And then next I'm going to move on to cranial nerve 9, 10, and 12. 9 is glossopharyngeal. And also with cranial nerve 9, patient, can you swallow for me? Can swallow for me. And then cranial nerve 12, can you stick out your tongue straight? Okay, hypoglossal. Cranial nerve 12 is intact. Then next, moving along from there, we know that cranial nerve 10 is intact because that's vagus. He does have a clear speech. And then also with cranial nerve 5 and 9, we can do the taste test, and I will have the patient put something in his mouth, have him close his eyes, and he'll be able to identify what it is that he's tasted. Then with our cranial nerve 11, spinal sensory, just have the patient shrug his shoulders for me. Okay. Our resistance, cranial nerve 11 is intact. So that concludes our neurological component of the assessment. Then our next step from there would be the abdominal assessment. At this point, I will have Mr. Scott go ahead and lay down for me. Okay. At this point with our abdominal assessment, next thing I'll do is I'll come over and I'll let the patient know that I'm going to lift up their shirt. And at this point, I'm going to do a visual assessment of the patient's skin, knowing that the color is symmetrical to the rest of the body. I'm also going to note that he does have hair present. on his abdominal area. No scars, lesion, no piercing, no striae, vascularities or lesions noted. Next, I'm going to inspect his contour. If I get level down with it, I notice that it's rounded. It's not necessarily flat, but it is rounded. I notice that his umbilicus is midline. It's inverted. No visible peristalsis noted. No pulsations noted at either. And then after I do that, I'm next going to auscultate for bowel sounds. And when auscultating for bowel sounds, I'm going to always start in a right lower quadrant. Ideally, you want to listen for about a minute in each quadrant if there's anything abnormal. So, just to let you know, I'm going to listen each quadrant. This is kind of cold. Okay, patient's bowel sounds are active, they're not hypoactive or hyperactive. Next, I would perform a light palpation after listening to the bowel sounds, just to make sure that there's no pain noted. Feeling pain? It's right here. Here?
No.
Here? So with light palpation each quadrant, patient denies pain at this time. Now after I do light palpation, I'm next going to start with a more deeper palpation, just to make sure that there's no rebound tenderness or anything like that. So as I'm starting with each quadrant, right lower quadrant, feel any pain here?
No.
Appendix is that. Then moving up to our right up quadrant. Gallbladder, is that any pain?
No.
Okay. So we did right lower, right upper. Now we're going to our left upper quadrant. Any pain near your stomach area?
No.
Then we're going to our left lower quadrant. Any pain down here?
No.
Where the stomach colon is at. So, patient denies pain with light palpation and deep palpation in each quadrant. So after we have completed the abdominal assessment, our next goal at this point will be to move on to our musculoskeletal component of the assessment. So when we're doing our musculoskeletal component of the assessment, I'm going to, while Mr. Scott is already laying down, I'm going to assess his hip range of motion in regards to his extension and flexion. So while he's laying down, Mr. Scott, if you could raise this leg for me. Okay, let's go this way. Out. Okay, go out this one. In. Out. Okay. Can you lift both legs for me? Back down. Can you bend? Okay. Next, I'm going to ask you to sit up for me. Okay. So as he's sitting up for me, I'm going to next have Mr. Scott do the upper range of motion in his arms. Can you put up your arms like this for me? Okay. Now, I'm going to try to pull on you, and you try to block. Okay. Do this for me. Tighten grip. Okay. Now, let's do your range of motion in your neck real quick. Here, 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 here. Okay. Range of motion is intact. Next, I'm going to do your hands. Grip my hands as I try to pull up. Okay. Alright. That completed. Then we're going to do the finger to nose test. As I put my finger here, I want you to touch your nose while touching my finger and then back to your nose. Just following my finger. Okay? Touch your nose and then my finger. Okay, so we're completing the finger to nose testing. Next, we're going to do the heel to shin test. At this point, I will have Mr. Scott take the heel of his foot and bring it up here and back down again, and doing it with both legs alternating between the two. Next leg. Okay. So after completing the heel to shin test, next I'm going to have you do rapid alternating with the fingers, starting here. Okay, now that's intact. Next, we're going to do 1 point, 2 point discrimination. I'm going to have you close your eyes for me. And what I'm going to do is, you tell me if I'm using 1 or 2 points.
2, 1, 2, 1, 2, 1.
Okay. So we established the 1 point to 2 point discrimination. Next, while I'm looking at his arms, also want to make sure we inspect the skin. Looking at the skin, looking at his joints, nothing is swollen, red. He can move it, no contractions. Same as with this one, no swelling or contractures noted. You can bend and move that as well. Next, I'm going to have him stand up for me. I'm going to assess his gait. I need you to walk from there and back up here. Okay, we're going to do the one bird stance. I need you to close your eyes and put your hands out. Okay, so one bird stance is negative. He doesn't have any swaying with the eyes closed. Okay, next I'm going to ask you to bend, touching your ankles. I'm just checking his back. There's no abnormal curvature noted. As when he was walking, Mr. Scott had normal gait, no swaying or unsteadiness noted. And then I'm going to have Mr. Scott do the ankles. I'm just going to bring the camera closer. Mr. Scott, when doing your ankles, if you could flex your feet out, doing the ankles, bend them back and forth, up and down. Okay, now just your toes. Okay, so now that we did the ankles and the feet, we did his hips, and making sure we did the knees. So after performing all of the things above, with the abdominal assessment, the neurological, and the musculoskeletal section, the patient completed everything as indicated. Assessments, abnormalities were pointed out, and that concludes my assessment.